The United Nations says 3 more African countries are joining a rollout of malaria vaccines targeting millions of children in Africa, which accounts for 95% of malaria deaths. Benin, Liberia, and Sierra Leone are offering the malaria vaccine as part of their childhood immunization programs. 2 vaccines, RTSS and R21, recommended by the World Health Organization, are being seen as a breakthrough for child health and malaria control. Africa Vaccination Week is held every year in the last week of April to advocate for stronger and more effective vaccine delivery systems across the continent. The event coincides with World Immunization Week, which emphasizes the collective action needed to protect people from vaccine-preventable diseases. The WHO says immunization prevents up to 5 million deaths a year from diseases like diphtheria, tetanus, and measles. UNICEF reports that at least 20 million children missed life-saving vaccines in 2022. That's 2.1 million more than in 2019. But the new simplified cholera vaccine approved by the WHO allows larger volumes of the serum to be produced faster and reach more children. As Africa Vaccination Week closes, I spoke with Thabani Maphosa, GAVI's Managing Director of Country Programs Delivery, to discuss progress made on the vaccination front and other challenges.
In the last 50 years, 6 lives have been saved every minute with vaccination. In the last 23 years, GAVI has been part of the story, and it has been vaccinating half of the world's children, and it has reached 1 billion children that have been vaccinated.
What is the significance of the approval of the new UV-Col-S vaccine, particularly in the context of the recent increase in cholera outbreaks globally?
The significance really is where we are from a time perspective, that in no time in history have we had such large and significant cholera outbreaks as we do now. And so another vaccine and an increase in supply really means we are well poised to begin our plans to move towards preventative campaigns or preventative programs. We are not there yet. Because of the demand that has been surpassing supply.
Vaccine access has been a problem for some countries, especially coming out of COVID. So what is being done?
Well, I think equity is at the heart of the GAVI mission, as you know. So that means that as we think about our countries in totality, we really try to match our supply to the demand, but we also really try to understand the epidemiology or the disease burden in these countries. And in that regard, we try to prioritize those countries that are at high risk.
GAVI is working with the Tanzanian government currently to launch a nationwide HPV vaccine campaign to prevent cervical cancer in the country, among other things. Can you provide more insight on this initiative?
The number of girls that Tanzania is projecting to protect is about 5 million, 9 to 14-year-old girls. And I can tell you that this is the number of future cancer cases, cervical cancer, averted, if we are able to come anywhere close to that number. Tanzania as a country has more than 10,800 cases. And of these, in 2022 alone, if you can imagine, we lost, unfortunately, 6,800. So this vaccine excites me because it really is about protecting the mother, but it is also about protecting a family. It is about protecting a girl, but it is also about protecting her future family as well. The thing that is also important about this vaccine is that we have moved to a single dose. So meaning that we can reach more girls than we would have if we were using 2 doses as in the past.
So what is your message as African Vaccination Week ends this year?
In Africa, I can say that an estimated 51.2 million lives have been saved through vaccine in the past 50 years, meaning that in each year we've been saving maybe roughly on average one 1 million lives. But I should argue that there is more that can be done. I think we just have a meningococcal vaccine for the meningitis belt, and this is going to protect with 5 serotypes. We used to have one that was protecting 1 serotype. It means that the health benefits are just going to multiply in a significant way. The message is both for Africa but also beyond Africa. The investment in vaccines is one that should be sustained. As we go towards replenishment, we must actually recognize that the investment in GAVI has been the best buy for money. But we must also recognize that countries have put their own money. Just in 2023, 215 million of domestic financing has come through as part of their country's contribution towards immunization. And it must be recognized as a very important contribution. Then you and I, the last time we spoke, we were speaking about malaria. Malaria is the #1 killer. And if it has killed anywhere in a huge way, it has been in Africa. And help is on the way. And Africa must stand up and take up that vaccine and use it as effectively as it can.
That was Thabani Maphosa, GAVI's Managing Director of Country Programs Delivery, speaking from Johannesburg. That's our health report for today. To stay in touch, find me on X at Linord Moudou.